go to neuropathy and peripheral blood flow. This is a common question. We got people with neuropathy, sciatica, carpal tunnel, all kinds of neuropathies and distal pain. Well, with every neuropathy, there's always a lack of blood flow. Look at the chart there. So you got this blood flow, this deep blood flow that is bathing the nerves. And now you start to lose blood flow, and then the nerve starts to shrivel up. Now, the lack of blood flow can come from an injury. It can come from compression. It can come from diabetes. It can come from a lot of things. But once the nerve gets this injury, there's a loss of good nerve blood flow. And now the nerve starts to shrivel up. Dr. Tom is a perfect example of this. Not only was he losing circulation in his legs and had ulcers, but his nerves were not functioning, and he had neuropathy. Peripheral nerve injuries directly impact blood flow, and it is essential that we reestablish these vascular networks. Well, guess how you do it? Based on studies included in this review, I'm going to post it for everybody. It appears that blood flow restriction seems to be beneficial in neurological disorders. Yes. What are they saying here? We need to avoid adverse side effects. That's why we do these short sit to stand sessions for 2 or 3 minutes. We don't want to put a BFR band on a neuropathy for 20 minutes. That wouldn't be very smart. We want to put it on for 2 or 3 minutes, get the burn, get it off, turn on nitric oxide. Here comes the improved blood flow to the nerve, and the nerve can start regenerating. And I can tell you, every single person I've helped or talked to or doctor that I've consulted with, and I say, get the bands on, do a wall sit, and I'm going to show you some protocols here. Do something quick, get a little burn, get them off, watch what happens. And the same thing always happens. Now, I don't know that we're going to cure, but we're talking about you start making improvements in people's neuropathy pain and improving blood flow. Man, are you improving quality of life?